Welcome to the BioBalance Healthcast, episode 675. Do you need antibiotics with your pellet insertion?
BioBalance Healthcast features conversations about anti-aging medicine. Your host is Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging. Dr. Maupin is the author of The Secret Female Hormone, the seminal work about testosterone replacement therapy for women, and Got Testosterone, the award-winning book for men that helps men choose the most effective and safe form of testosterone replacement. These books are available on Amazon or from Dr. Maupin's office at BioBalance Health in St. Louis and in Kansas City. Dr. Maupin's office is currently accepting new patients.
Welcome to the BioBalance Healthcast. Today we're going to talk about something that you probably haven't even thought about unless you are a person who has had a joint replacement, or you have diabetes, or you have other conditions that decrease your ability to fight infection. And that is, do you need antibiotics when you have any kind of procedure that cuts the skin or any procedure in your mouth that might stir up bacteria? Most people who have had a joint replacement have been told by their orthopedic surgeon whether they need antibiotics with any type of procedure or not. But we find that not everybody remembers or listens to their orthopedic surgeon or their primary care when they tell them that they need to take antibiotic prophylaxis, is what we call it, or prevention, when you get any kind of procedure that breaks the skin, leaving an entry point for bacteria. Now, there are several different reasons that you need to have antibiotics. If you're a person who has a joint replacement and your doctor told you you have to have antibiotics, then that is one kind of person that would need this. Another is somebody who has type 1 or type 2 diabetes that is out of control. So that means there's a couple things that type 1 and type 2 diabetes the severity goes by what your hemoglobin A1C is. And if your hemoglobin A1C is greater than 9, or if your fasting blood sugar is greater than 150, then you probably need antibiotics for any type of procedure. Now, we evaluate our patients for this, and we give them a prescription of antibiotics to take if they have this condition, and they are what we call out of control or difficult to control. A third type of patient that might need prophylaxis with antibiotics would be somebody who has an autoimmune disease like rheumatoid arthritis or lupus or psoriatic arthritis and takes a type of drug that suppresses their immune system so that they don't respond with killing T cells when they have any kind of infection. We want to prevent infection in those folks, and so we usually ask them to talk to their rheumatoid arthritis doctor or their doctor who takes care of autoimmune diseases, and ask them whether they are on a drug that needs antibiotics. If they don't know, and it's their first appointment, we usually will give them an injection of something like Rocephin, which is like Keflex, only an injectable, at the time of their insertion so that they can then have time to go ask their doctor, their rheumatologist, if they need to have antibiotics anytime they have a procedure. The last big group of people that might need antibiotics would be people who are receiving cancer treatment at the time. Cancer treatment usually suppresses your immune system. That's how they usually work. And if that, like radiation and chemotherapy, both suppress the immune system. So those people who are undergoing treatment when they get their pellets, those folks usually need antibiotics. And we'll do the same for them as we do for our patients with autoimmune diseases. We'll ask them to talk to their doctors who are taking care of their cancer and to see if they would require antibiotic coverage. So when I talk about antibiotic coverage, I want to make you aware, but also a little bit more comfortable with this. Usually we just write a prescription for amoxicillin if you're not allergic to penicillin, and we have you take it an hour before your procedure. All of the guidelines have changed. That's the first drug of choice. If that drug of choice is something you're allergic to, then we go to Cleocin, or we go to sulfa medications, Estradiol, something like that. And that would be something that we would write a prescription for you to take before your insertion every single time. So you would have to bring it with you as you're driving or when you leave your house, take your medication. And don't forget, if you do forget, you have to tell us so we can give you some antibiotics at the time of your insertion. So it's your responsibility to tell us if you haven't taken your antibiotic. So we are dedicated to making sure our patients are healthier when you leave us than when you come. And we want to be very safe and effective. I want to make sure that you understand you have to talk to the treating doctor, the doctor that treats you for your joint replacement or for your diabetes or for your autoimmune disease. Those doctors are the ones that know exactly what you're on and if it suppresses your immune system enough to need antibiotics. And I guess the other thing is why you need antibiotics. It used to be that we were preventing bacteria that might get into your blood from going to your heart and causing endocarditis. Now, they've taken that off the table. The powers that be have said that that's not necessary for that reason. But implants, like I had a shoulder replacement, and I have a fake shoulder, basically, and a titanium shoulder. So my doctor said you have to take antibiotics for 6 months with any kind of dental or invasive procedure, even a dermatologic biopsy. But that's it. After 6 months, you don't have to do that anymore. Other doctors give different directions. We want the directions from the treating doctor and want you to tell us what they are, and then we'll put that in your chart so that we know whether we give you antibiotics or not. Now we give you antibiotics so that it doesn't infect the actual implant. We give you antibiotics so you don't get an infection in the site, on your hip where we put your pellets. So those are the two reasons everyone who's not on the list with a joint replacement, you need the coverage so that you don't get an infection in the wound or get an infection in the insertion area around your pellets. So even though we use sterile technique, you can still get an infection if you don't have an intact immune system. So it's very important. We don't want to have any complications. Thank you for listening, and I hope this helped you understand the difference between why one person would need antibiotics and another may not, and how you should determine whether you need them or not. Thank you.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/BioBalance Health.